Ruth Dyson.
Thank you, Mr Chairman. I'm pleased
You're
to be
welcome.
taking a call on Part 4, which is the substantive part of this amendment bill. And I want to just start by looking at 70A1, the new part which is being inserted after Section 70 of the primary legislation. But before I do that, can I just say that I'm really puzzled as to why on earth the Minister has signed off on a proposal to insert family care policies in this particular part of as an amendment to this particular part of the primary legislation. If you look at the New Zealand Public Health and Disability Act, which we certainly were in more detail in the last debate, Section 70 is just further provisions. This has been an add-on, you know, just throw it in where we think we've got a bit of a space between two other provisions, and I think it's a further undermining of the status of the family caregivers that is being reflected in this amendment. In the purpose of this part, where new part 4A is being inserted, it doesn't say that the purpose of this Act is to ensure that family caregivers who took a case to court and who won, not only at the Human Rights Tribunal but also at the High Court and then the Court of Appeal, it doesn't say anything about so that they and other unpaid family caregivers can get proper recognition of the work that they do instead of somebody else, a stranger, being paid to do it. No, it doesn't say that at all. I would have thought that would have been the primary purpose of the legislation, to give a bit of justice to the people who are family caregivers who currently aren't getting paid but are doing the work. But oh no, this is different. What it says the purpose of this part is to keep the funding of support services provided by persons to their family members within sustainable limits in order to give effect to the restraint imposed by Section 3.2 and to affirm the principle that in the context of funding of support services, families generally have primary responsibility for the well-being of their family members. That's a bit of a listen to you, High Court and Court of Appeal. I'm the Minister of everything and I can do what I like. So leaving aside the fact that these families took that case through the Human Rights Tribunal to the High Court and won at the Court of Appeal, the Minister's saying, I don't care. The principle is that in the context of the funding of the support services, families generally have primary responsibility for the well-being of their family members. Actually, the High Court and the Court of Appeal said that the family members should get paid for that part of their work. This doesn't reflect those findings at all, and I think it's a slap in the face to the judges, actually, and more importantly, to the families, including the disabled people themselves. Mr Chairman, as was alluded to by my colleague, the Honourable Annette King, I have moved a number of amendments to this section. I think there's 10 on the order paper and 10 on the table at the moment to this part, and I'll be speaking to them at various stages of the debate. But I don't want to do that in the context of this presentation, because what I'm more concerned about at the moment is the actual wording of the original legislation itself. I don't think that it is an indication at all of the importance of this issue, of the sensitivity of the issue, let alone of the fact that this policy issue has been heard by courts in this land. It doesn't recognise that at all. It excludes people under this family care policies. It excludes people for no good reason at all. It doesn't say this is an incremental policy, we're doing it as funds allow, we'd like to look at the highest needs area first. There's no analysis at all, and I say to the Minister that he should be ashamed of himself. There's no analysis at all of the link between the level of impairment of the individual person and the need of the family for additional support. That could be quite at odds. They could be quite unrelated to each other, actually. We're assuming that the need of the disabled person is reflected in the financial recognition that is deserved, under the Minister's terminology, by the family, and I don't see that automatic co-relationship at all. In fact, it could be quite the opposite. We could have some very, very, very high-income families for whom this payment will make not a jot of difference, who have very high-need family members. We could have very, very, very low-income family for whom this payment will make all the difference in terms of their ability to have a bit more security and opportunity in their life, who have quite low-level needs, Mr Chairman. Mr Chairman?
The Honourable Ruth Dyson.
Thank you, Mr Chairman. We could have very low-income families for whom this miserly payment could make a huge amount of difference between their ability to do things in their life and their current inability to do that. But their family member might have quite low needs but still require quite a lot of support. So the inability of the link between the impairment of the disabled person and the ability of the family member to need or do better with this payment isn't secured at all. Mr Chairman, I tried earlier to have some consultation injected into this policy because for me it's quite an important principle that if you're making legislative change that has an impact on somebody, then that somebody should be involved in the preparation of that policy. The Minister tried to talk about how much consultation was done, but it's actually a lot of spin. When you talk to the family members involved, they had no idea at all that this policy would not just exclude large numbers of families who care and support for disabled members of their own family. They had no idea that such a massive exclusion would take place, let alone the fact that those families who are excluded from being paid for caring for their family member are also having their right to take a case of discrimination imposed by the government to the Human Rights Tribunal so that they could have a fair hearing. That right is being extinguished by this legislation. Why would the Minister do that? Why would the Minister pretend in his spin that this is looking at the families most in need to start with, and that, of course, this policy will be rolled out, while at the same time extinguishing those families' rights to take this to human rights? I'm not surprised that the Attorney-General found that extinguishing of rights was not appropriate. I am surprised that the Attorney-General hasn't taken a call so far in this debate. Generally, when you have a breach of the Bill of Rights provisions, you would see the Attorney-General in the House making some explanation for it, or at least drawing it to the attention of the House in person, rather than just a very late report that was tabled without any explanation at all. Of course, we all went to the table and had a look at it because it was fairly clear that these provisions do breach the Bill of Rights Act. But we've had no explanation of it at all. We've had nothing from the Minister to justify the fact that this legislation not only excludes those family members from getting payment for the work that they do, despite the case in both the High Court and the Court of Appeal saying they should get paid for it, but it also extinguishes their right to take further legal action. Mr Chairman, as I indicated earlier, I have got a number of amendments. Some of them involve consultation, which I think is important. Some of them involve the rates of pay, because it's not at all clear to anyone in the House from what the Minister said, because it was such a pathetically lightweight contribution. It's not at all clear why the Minister thinks that the work that a family member does is worth less financially than the work that a stranger or a person from down the road thinks. The Minister has consistently refused to answer the questions, and I heard one of my colleagues say that the Minister might not know the answer, might not know what the operational solutions are going to be to this legislation. But, Mr Chairman, what I think every single member of this Parliament will want to know before we leave for home on Sunday morning is when on Monday we go down to our electorate offices, what are we going to say to family members who say, will I be getting paid for caring for my son or daughter or parent or spouse in October? Will I be paid for that? And we have no idea. This legislation being rammed through all stages without any input from the public at all has got as many unanswered questions as it has answered questions. And that is just not good enough. For For families who have been waiting, as the Minister said, for 2 decades for an answer, now they're hearing in the media that this legislation is going to be passed. What is their expectation, Mr Chair? Well, I'll tell you the answer to that, because I don't think, Mr Chair, that you are going to take a call and answer my question. I think that's about as likely, actually, as the Minister taking a call and answering my question. No chance at all, because the Minister's not up to it, frankly. It's tragic to have a Minister in that situation.
I'm going to call the honourable member, Dr. Raj.